For this panel today, we have renowned mental health expert Dr. Devendra Save with us. He is a well-known psychiatrist in Dahisar, East Mumbai, and has an experience of 24 years in this field, and has completed his MBBS from Grant Medical College in Sir J.J. Hospital, Mumbai in 1994, and has also done his MD in psychiatry from Grant Medical College in Sir J.J. Hospital, Mumbai in 1998.
See, as compared to earlier days, the stresses on youngsters has increased. The expectations have increased. Number of fields which they can excel into have increased. People who have already excelled as their role models have also increased. They are a free-willed generation with a wider outlook towards life, but the previous generation has always been a conflict with them. They are sort of ill understood, tried to be directed, and in doing all these things, the amount of stress which comes on them is also very high. Another thing which I've seen is that along with assertiveness, there's a lot of sensitiveness in millennial generation. So they are very sensitive, and they feel, and they stand up for lots of rights also. Keeping all these things in mind, this generation definitely has a more of mental health issues. Like, definitely we can see more of anxiety issues. We can see a lot of even depressive issues. The personalities are coming out in a stronger manner in this generation. They are more stronger personalities. There are adjustment and conflicts which happen in and around their life, and especially expectations, relationship issues. Because as compared to previous generations, more of millennials are in a relationship at a younger age, and with conflicts in the relationships, trying to maintain them. Even relationship issues are very important. For this generation, friendship, companionship are also very important. So they get definitely issues at that background also. They start working at a younger age. They are in a job which is much more demanding as compared to what it used to be from generations prior to them. And the level of work as well as the amount of work has both increased. So working long hours, trying to balance the other aspects of life, their own aspirations also become an issue. So all these things together, we see that millennials are definitely facing much more mental health issues. And the best part is that they are aware of these issues. They seek help for it. They are willing to go ahead with a nice approach, rather than just in the previous generations, especially in our nation, which was in a phase of denial. So that's a very nice thing about the millennial generation.
Okay. So it was like nice to know that it was like millennials are now seeking for the help, but what kind of therapy they are seeking for? What kind of therapy the millennials go for generally?
It is not the way you are putting it across that they go in for a therapy. They go to a therapist, and it is for the therapist to decide according to the need of the client what therapy he or she requires. So generally what we do is that when a client comes, there's a session of complete hearing the client out. He or she is completely heard out with regards to an uninterrupted kind of a session where the feelings are expressed out, the areas of issue are looked into, and then specific questions are also asked to get a deeper insight into whatever is the problem. Also, along with that, we can run psychometrics, which are very, very useful in understanding various aspects of mental health. Like, for example, we have tests which will tell us about the personality of a person. We have tests which will tell us about the clinical scales, like if there is generalized anxiety disorder, then to what extent it is, or if there's a post-traumatic stress disorder, to what extent it is a person prone for alcoholism, drug dependence. All these things can come up in psychometrics. So we generally run a psychometric where a person is not very easily expressive, or at times we find that the person is in a form of denial, we do some sort of projective test like Rorschach, which will be showing us things indirectly, what is happening at the level of your mind. So based on all these things, the therapy or the course of therapy is decided. Many a times, millennials not just are very happy with individual therapy, but do extremely well with group therapy, where the group is of similar kind of problems. And like, for example, a borderline personality disorder group where dialectic therapy is done. So these sort of group therapies are also done. For OCD, we do group therapy. For PTSD, groups are done. So for anxiety disorders, groups are done. So group therapies also work extremely well with them. So it's tailor-made for a person. It's not that they seek a particular type of therapy. The therapist should decide along with the client what kind of a therapy is really going to benefit the client.
People will say like they are the generation of therapy. Why are they are the generation of therapy? And is the therapy only thing that millennial can take or cross to overcome their mental health? And why we say that they are the generation of therapy?
If you look behind and see, there has been a denial of mental health. Earlier, mental health used to be just about serious mental health issues like schizophrenia and bipolar disorder, or severe depressions, or severe OCDs. Conflicts, personality disorders were supposed to be a okay kind of a thing. Relationships were to be sorted out between two people or with help of family, or just be accepted as they are and moved ahead. The problems, the expectations of growth, personality development were not many. This generation has realized that these are not the actuals, and they require to have everything in a right, perfect manner. Hence, they are seeking more of a therapy, and they are seeking more of a help to help them grow and help their life be a little more fruitful as compared to previous generation. It's a generation which has got a much better outlook and knowledge towards mental health. And that is the reason why they are seeking therapy, because they understand that this is something which is very helpful. See, therapy makes a difference for anybody and everybody who goes through a therapy. For person to go through a therapy, first is that the person should accept his problem and should have a desire to come out of it and turn into a better individual with regards to whatever the problem or the issue is. The issue could be at the level of personality, could be at the level of relationship, could be at the level of a depressive disorder, anxiety disorder. It is basically restructuring of your thought processes and your behaviors. So it helps everybody. What is nice is that the millennials have realized that it helps, and they are seeking it and benefiting out of it. And see, whenever a person benefits out of it, he goes and tells another 5 people that, yes, I have benefited out of it, and I think you should also look at it. And hence, this generation is now discussing, talking, seeing the benefits of a therapy and recommending. And hence, I can see more and more clients coming in, where one millennial comes in, usually another 5 follows if he has benefited out of it, and then another 25 follow because 5 have benefited out of it. So it's a very, very nice approach which they have, a very healthy approach. So this question has been asked to me multiple number of times. What I usually suggest is that it all depends upon the comfort of the person. One is that. Second is, this generation is very comfortable with online interactions. They are very comfortable with video calls and Zoom meetings and Google Meets and whatever those ways of meetings are. So already the comfort is there. But personally, I personally prefer that at least the first session and a session intermittently in between, if possible, if it is in the same city, can be done offline. So that really first session at least helps the interaction to really happen in a much more heart-to-heart manner. as compared to an online session. Second, what I really prefer is that the person who goes in for therapy, should go in with an open mind that this is not my therapist on the very first day. So he can interact with the therapist. It's very important that both of them match completely. So you interact with the therapist in the first session, maybe in the second session. If you don't find the therapist, not everybody is going to find Dr. Save perfect for them. So change. We have got lots of therapists and mental health professionals in today available for our services. So you can always change your therapist to a therapist with whom you feel that this person is really the person who can help me, or who is really somebody who I can get helped by. And then you continue with the therapy with that person over a long period of time, because it's usually not just 1 or 2 sessions which ends the matters.
To the 5 quick tips for our viewers of millennial generation for a better mental health.
One is to have a complete life. There should be a balance between work, personal life, relationship, family life, sport, and physical health, diet. So a complete wholesome life is something which is very important. Second is learning to be very assertive in life. We have to say yes where we want to say yes. We have to learn to say a no also where we cannot say a yes. We have to have that assertiveness put inside us and not let somebody take advantage of us. Third is to be sensitive but not oversensitive. Take things in a empathetic manner, but let that empathy not overpower you, that it goes beyond the point where it starts hurting and troubling you. Fourth is also learn to really say no to relationships also. There are times I've seen a lot of relationship related issues happening in millennials because they are unable to say a no to the relationship. So somewhere learning to say a no to things in relationship also, and planning out is very, very important. Have a roadmap, have a plan as to how the things are going to progress, because lots of millennials want instantaneous kind of a result gratification, and in trying to do that, the disappointments are very high. You have to understand that it's over a period of time that success turns to you rather than overnight. So a plan, roadmap, acceptance of increasing the power of acceptance of negatives happening in life is also very important. These are a few very important tips which I would like to give this generation.